imagine being told that, the everyday products you've used for your period since you were a teenager are physically altering your anatomy.
Yeah, it's a harsh reality.
It really is. That the standard sanitary pad you buy at the pharmacy is, like, actively contributing to irreversible architectural changes to your body. That is the reality for many people navigating chronic autoimmune conditions. And it completely shifts how we have to think about something as routine as a monthly cycle.
Oh, absolutely.
So today, we are taking a massive stack of clinical guidelines, NHS advice sheets, and specialist clinic FAQs to answer a highly specific but incredibly vital question for you. Can a patient with lichen sclerosus safely use menstrual cups or tampons during their period?
It is a question that really requires us to look past the marketing of menstrual products and dig directly into the biomechanics of how these materials interact with highly vulnerable tissue.
Right.
Because for anyone managing this, a monthly cycle can feel less like a natural process and more like, well, trying to run a marathon in wet, sand-filled shoes. I mean, the environmental conditions just actively worsen the physical friction.
Okay, let's unpack this. Because you probably already know the daily reality of lichen sclerosus, the intense itching, the soreness, the structural changes, and that fragile wax paper thinning of the skin.
Exactly.
Adding the mechanics of a menstrual cycle on top of that just feels incredibly daunting. We are talking about tissue that is already under an autoimmune attack. But looking through the initial clinical overviews, there's this prominent myth that gets addressed right out of the gate.
Right, the idea that the period itself is causing the condition.
Yes, exactly.
The literature is very clear on separating the underlying disease from the triggers. Menstruation does not cause lichen sclerosus.
That's such an important distinction to make.
It is. However, the menstrual cycle operates as this perfect storm of biological and environmental triggers that can, initiate a severe flare-up. To understand why, we really have to look at the hormonal shifts that dictate a period.
Okay, so what's happening hormonally?
Well, in a luteal phase, just before menstruation begins, the body experiences a significant drop in hormones, particularly estrogen.
And estrogen is essentially the hormone responsible for keeping the mucosal linings and the vulval tissues plump, elastic, and resilient, right? Like, it maintains the structural integrity of that barrier.
It does, yeah.
Yeah.
It promotes blood flow and cellular turnover in the pelvic region. So when estrogen levels plummet just before bleeding starts, those tissues become biologically thinner.
Wow.
They lose a significant degree of their natural elasticity. I mean, the shield is effectively lowered on a cellular level.
And then you introduce the physical realities of menstruation on top of that weakened shield. You have a constant flow of moisture from menstrual blood combined with, like, the mechanical friction of sanitary products rubbing against tissue that is not only hormonally thinned, but already compromised by the autoimmune disease itself.
Which brings us to a foundational medical concept mentioned across all the NHS and specialist guidelines. To understand why certain products are dangerous, we have to understand the Koebner response.
The Koebner response.
Right. This is a phenomenon where physical trauma, mechanical friction, or localized damage to the skin actually triggers the underlying autoimmune condition to worsen at that specific site.
So wait, the immune system basically misinterprets the mechanical stress. It senses the friction from a pad, assumes there is an injury, and rushes inflammatory cells to the site.
Exactly.
Which just fuels the autoimmune attack on the healthy tissue.
The Koebner response turns everyday friction into a biological alarm bell.
It is basically like wearing a rough, itchy wool sweater over a severe sunburn.
Yes.
The skin is already hyperreactive, it's already screaming, and then you add this relentless mechanical rubbing to the mix, which just amplifies the damage on a cellular level.
That's a perfect analogy.
Yeah.
And when we look at the specific design and chemical makeup of standard commercial sanitary products, they almost seem, well, engineered to trigger this exact response.
Oh.
A standard pad or panty liner is often manufactured using synthetic plastics, polyolefins, industrial bleaches, and artificial fragrances. They are highly occlusive, meaning they don't allow the skin to breathe at all.
Oh, so they act like tiny scented greenhouses trapped against the body.
Yes, and that greenhouse effect is absolutely devastating for lichen sclerosus. The synthetic backing traps heat and moisture against the vulval skin. This constant exposure to moisture acts as a macerating agent.
Macerating, like when you stay in the bath too long.
Exactly. Maceration is what happens when your fingers prune up. The skin barrier becomes waterlogged, soft, and incredibly weak.
Oh, man. So you have a hormonally thinned, waterlogged, structurally weak spin barrier, and then as you walk and go about your day, the stiff edge of that synthetic plastic pad repeatedly saws against the inflamed vulval skin.
It is the textbook recipe for inducing a severe Kovner response. The mechanical friction directly compromises the stratum corneum, which is the outermost layer of the skin.
Right.
And that allows the chemical irritants from the synthetic fragrances and bleaches to penetrate deeper, triggering a massive inflammatory cascade.
Which perfectly explains why the Elite Aesthetics Guide and the Lichen Sclerosus Guide both heavily suggest ditching standard disposable pads entirely.
Absolutely.
They recommend a complete pivot to 100% cotton, unbleached, unscented pads or reusable cloth pads that are washed in non-biological detergent. You are stripping away the chemical variables and prioritizing breathability to dismantle that greenhouse effect.
You have to eliminate the trapped moisture and the synthetic edges. Natural, unbleached cotton fibers allow the microclimate around the vulva to remain cooler and drier, which inherently stabilizes the skin barrier.
Here's where it gets really interesting, though. When we shift our focus to internal products, specifically tampons, the sources actually present a striking contradiction.
Yeah, they do.
I'm looking at the Vulva Care advice sheet from the British Society for the Study of Vulval Disease, and it gives a hard, uncompromising directive. It just says, avoid tampons if possible. But then you read the clinical advice from the Elite Aesthetics Guide, or the Comprehensive LS Guide, and they offer a much more nuanced reality for people who strongly prefer or need internal products.
Well, medical guidance often struggles between what is theoretically ideal and what is practically manageable for the patient. Telling someone they can never use a tampon again just isn't always feasible for their lifestyle.
Yeah, people just won't listen.
Exactly. Compliance with medical advice plummets when the rules are too rigid. So the more comprehensive guidelines offer strict rules of engagement to mitigate the risks if you do choose to use tampons.
And those rules mirror the advice for pads, don't they? They mandate that the tampons must be 100% organic cotton, completely unbleached and unscented, no rayon, no synthetic blends, no hidden plastics in the core.
Right. Rayon is particularly problematic because its synthetic fibers are designed to expand rapidly and absorb liquid aggressively.
Which you'd think is a good thing for a tampon, but
Not here. This leads to the second major rule in the guidelines. You must use the absolute smallest absorbency needed for your flow.
because high absorbency tampons, especially those containing rayon, don't just absorb menstrual blood, they draw out the natural, necessary mucosal moisture from the vaginal walls.
Exactly. They dry out the tissue, and as we established, dry tissue is fragile tissue.
The guidelines also advise against switching tampon brands frequently.
To avoid new allergens.
Yes, the goal is to limit the number of new variables, potential allergens, or different manufacturing chemicals that you expose mucosal tissue to. Consistency helps the immune system remain calm.
I mean, I'm looking at these guidelines and I'm honestly a bit confused by the mechanics of this. Even if a tampon is 100% organic cotton, it is still essentially a dry cylinder of fibrous material.
Yes, it is.
Inserting a dry plug through a vaginal opening that is chronically inflamed and prone to micro-tearing inherently causes friction. Aren't we just moving the trauma and therefore the Kovner response from the outside of the body to the inside? That is the exact mechanical dilemma the British Society for the Study of Vulval Disease is worried about when they suggest avoiding them entirely. The friction of insertion and removal can absolutely trigger a localized immune response.
So how do the other guidelines justify using them? There has to be a physical workaround.
The workaround relies on artificially altering the friction coefficient. The sources explicitly recommend applying a small amount of an emollient or a high-quality water-based lubricant to the tip of the tampon before you even attempt insertion.
Oh, wow.
They specifically call out the brand YEES as a safe, water-based option that won't irritate the mucosal lining.
So you are artificially creating a glide path to bypass the physical friction limit of the skin. By lubricating the cotton tip, you prevent the dry fibers from dragging against the vaginal entrance.
Exactly.
That completely neutralizes the mechanical trauma that would otherwise trigger the Kovner response.
You are bridging the gap between the rigid product and the fragile tissue. However, all the sources draw a very firm line in the sand regarding timing. Tampons must never be used during an active lichen sclerosus flare-up.
That makes total sense. If the skin is already fissured, if it's currently tearing like wet tissue paper due to an active inflammatory spike, forcing a foreign object in, even with a high-quality water-based lubricant, is just going to turn microscopic fissures into major painful wounds.
You have to listen to the immediate state of the tissue. If the vulva is actively inflamed, internal products are completely off the table for the duration of that cycle. The risk of exacerbating the structural damage is simply too high.
This raises an important question about the modern alternatives, though. If standard pads cause external friction and maceration, and tampons carry the risk of internal friction and mucosal dryness, what about menstrual cups or discs?
Right, the silicone cups.
Yeah. Theoretically, things like moon cups seem like the ultimate loophole for you. They're made of medical-grade silicone, they don't absorb natural moisture, and they sit entirely inside the vaginal canal.
What's fascinating here is how menstrual cups physically interact with the pelvic environment compared to traditional products. Medical-grade silicone is entirely inert.
Meaning it doesn't react with the body.
Exactly. It doesn't shed fibers, it doesn't harbor bacteria in the same way woven cotton does, and it is completely free of industrial bleaches or dyes.
And because cups collect the menstrual blood rather than absorbing it like a sponge, they don't disrupt the natural vaginal flora or dry out the mucosal walls.
Right.
Even better, they keep the menstrual blood entirely contained internally, so the external vulval skin, where the lichen sclerosus is usually the most severe, stays completely dry. You bypass the external moisture issue and the external pad friction entirely.
On paper, the menstrual cup is a brilliant physiological workaround. It eliminates almost every environmental trigger we've discussed. But we have to address a massive caveat found in the literature.
Okay, what is it?
Lichen sclerosus is not just a surface-level rash. Severe or long-standing cases drive chronic inflammation deep into the tissue, which leads to irreversible architectural changes to the anatomy itself.
We are talking about the scarring. The physical landscape of the body actually changes over time.
Chronic autoimmune response can lead to the narrowing of the introitus, which is the vaginal opening. It can cause the labia minora, the inner lips, to resorb or completely disappear into the surrounding tissue.
Wow.
It can even cause tissues to fuse together, including scarring over the clitoris, known clinically as phimosis.
So if a patient has experienced that architectural narrowing and a loss of elasticity around the vaginal entrance, the actual biomechanics of using a cup become incredibly problematic.
Very much so.
You have to fold a relatively rigid silicone cup, usually using a C-fold or a punch-down fold, and force it through an opening that may no longer have the capacity to stretch.
The silicone might be inert, but the mechanical force required to insert it and the pressure of the cup popping open inside a narrowed canal can trigger a massive Koepner response. The friction and stretching can cause immediate tearing in tissue that has lost its structural elasticity.
The sources are very clear that using a cup or disc requires careful, patient practice. You can use that water-based lubricant to help, but the golden rule applies unconditionally. If it hurts, you must stop immediately.
Absolutely.
You cannot force a rigid silicone object through scarred tissue without causing a severe flare-up.
So if the physical act of folding and inserting a cup is a barrier because of those anatomical changes, how do we manage a heavy flow without reverting to the external friction of a standard synthetic pad?
That is exactly the gap that period pants, absorbent period underwear fill. The modern sources, especially the LS Guide, praise period pants as a total game changer for managing this condition.
Yeah, they really are.
They operate on the same breathability logic as the organic cotton pads, but they improve the mechanical delivery.
High-quality, breathable, dye-free period underwear removes the stiff synthetic edges and the concentrated pressure points of a disposable pad. Instead of a rigid plastic core rubbing against the groin with every step, you just have soft, flexible fabric.
By integrating the absorbent material directly into the structure of the underwear, the garment distributes the physical contact evenly across a much wider surface area. It diffuses the mechanical load, which significantly lowers the risk of localized trauma.
It allows you to avoid the friction of pads entirely while still managing the flow externally.
So what does this all mean for the actual day-to-day treatment routine? Because navigating the flow is only half the battle. The gold standard, absolute baseline treatment for lichen sclerosus is the application of an ultra-potent topical steroid, like clobetasol propionate.
Yes.
Patients are instructed to use this incredibly strong ointment to suppress the localized immune response.
The standard regimen often requires applying a steroid every day for a month, then stepping down to alternate days, and eventually twice a week as a long-term maintenance dose. It is the absolute cornerstone of halting the inflammation and preserving the tissue architecture.
But if a patient is on their period and they apply this vital, carefully measured ointment to the vulva, the immediate anxiety is that the constant flow of menstrual blood will just wash the medication away.
Or dilute it to the point where it's completely ineffective.
Right. I can see why patients might be tempted to skip their steroid applications during their cycle to avoid wasting it.
That anxiety is incredibly common, and the sources go out of their way to dispel it. You must never stop your steroid routine just because you are menstruating.
Okay, good to know.
Consistency is the only way to manage an autoimmune condition. The fear of the medication washing away comes from a misunderstanding of how topical steroids actually interact with the skin barrier.
How does the ointment survive the physical flow of blood then?
It comes down to the application technique and the lipid matrix of the skin. The active steroid medication doesn't need to sit on the surface of the skin to do its job. It needs to penetrate the stratum corneum.
Okay.
The sources explain that if you take the time to gently smooth the ointment into the affected tissue for 60 to 90 seconds, the friction and the heat of your finger actually melt the ointment base.
And that allows the vast majority of the active steroid compound to absorb directly into the tissue past the surface layer.
Exactly. Once the medication has penetrated the lipid matrix of the skin, which only takes a minute and a half of gentle rubbing, it is securely locked in.
Wow.
Water and menstrual blood flowing over the surface afterward cannot easily wash it out because the active ingredient is already operating deeper within the cellular structure.
The job is already done. The medication will suppress the immune response regardless of how heavy the menstrual flow is. That fundamentally changes the approach to treatment during a cycle.
It really does.
And speaking of routine, as I was reading through these clinical guidelines, there were some hygiene hacks that completely upend how we are traditionally thought to clean ourselves.
Oh, yes.
The very first rule of hygiene with lichen sclerosus is to throw away every single soap product in the bathroom.
Shower gels, feminine hygiene washes, cleansing wipes, bubble baths, they all have to go. Even the products heavily marketed as gentle or pH balanced for women.
Why are the pH-balanced washes dangerous? I mean, they are explicitly marketed for sensitive skin.
Because even a pH-balanced wash contains surfactants. Surfactants, like sodium lauryl sulfate, are chemical compounds engineered to be amphiphilic, meaning they bind to both water and oils.
Right.
Their entire job is to grab onto dirt and oils and strip them away from the surface so they can be rinsed down the drain.
But when you use a surfactant on vulval skin that is already battling an autoimmune attack, it indiscriminately strips away the natural lipid barrier and the essential ceramides that the tissue desperately needs to protect itself.
Exactly. Without that natural lipid barrier, the skin loses its moisture immediately and is left completely defenseless against environmental triggers and mechanical friction. You are chemically destroying the tissue's ability to heal.
So how do you manage the physical reality and the mess of a period without using soap to clean away the blood?
The clinical recommendation is to use a peri bottle.
A peri bottle?
Yeah, it's a small, squeezable bottle with an angled nozzle. You fill it with plain warm water and use it to gently rinse the blood away while sitting on the toilet. There's no scrubbing, no harsh toilet paper, and no chemical wipes. Just a gentle mechanical flush of water.
And if plain water isn't enough to physically clean dried blood from the area?
The sources instruct patients to use an emollient as a direct soap substitute. Products like aqueous creams or hydromol.
Using a thick moisturizer to wash sounds entirely counterintuitive.
I know, it sounds weird, but it works because the greasy emollient binds to the dried debris in the blood, lifting it away from the fragile tissue.
Oh, I see.
When you rinse the area with warm water, the debris washes away, but the emollient leaves a thin protective layer of moisture behind. It cleans the area perfectly without chemically stripping the natural oils.
That brings up another brilliant hack from the sources. Using a heavy emollient like plain yellow soft paraffin or classic Vaseline as a literal force field during the period.
Yes, the barrier method. This is a critical strategy, especially if you are still using pads or period underwear.
The guidelines advise applying a thick, generous layer of barrier ointment over the vulnerable vulval skin before you put on a fresh pad, and reapplying it every time you use the toilet.
Because Vaseline is entirely occlusive and waterproof, it creates an exogenous lipid seal over the skin.
The menstrual blood and the physical friction from the pad literally slide right off the Vaseline layer instead of making contact with the inflamed tissue.
Exactly. It is a highly effective, low-cost way to shield the skin from both moisture maceration and mechanical Koebner triggers simultaneously.
So let's distill this roadmap down to the core takeaways. Can you safely navigate a menstrual cycle using tampons, cups, or pads while managing lichen sclerosus? Yes.
Yes, you can.
The sources make it clear that you have options, but those options require highly intentional strategic choices. If you choose external products, you must prioritize breathability with unbleached cotton or period pants to stop the greenhouse effect.
Right.
If you choose internal products like tampons or silicone cups, you have to mitigate the mechanical friction with water-based lubricants. And above all else, you have to respect your body's architectural limits.
This is so important.
If you are in an active flish-up or if insertion causes pain, internal products are an absolute hard no.
If we connect this to the bigger picture, the importance of these seemingly small daily choices becomes incredibly clear. Strategically managing your period with lichen sclerosus isn't just about surviving a few uncomfortable days a month. It isn't just about temporary symptom relief.
It's about the long game of bodily autonomy.
It is about long-term tissue preservation. Every single time you prevent a flare-up by choosing an unbleached cotton product or by diligently applying a Vaseline barrier cream, you are actively stopping the localized inflammation that causes deep tissue scarring.
Wow.
You're preventing the architectural changes that can permanently alter your anatomy and disrupt your physical and sexual function.
That's huge.
And perhaps most importantly, by consistently lowering that inflammation, you are actively reducing the small but very real lifetime risk of the condition progressing into squamous cell carcinoma, a type of vulval cancer.
Right, the cancer risk.
And statistical risk is less than 5%.
Right.
But meticulously managing the mechanical trauma to the skin is exactly how you keep that risk as close to zero as possible.
It is preventative medicine disguised as routine period care. Every choice matters. Which leaves me with the final thought I want you to mull over as we wrap up. We spent a lot of time today exploring the Koebner response, this dramatic, localized immune attack triggered by something as simple as the mechanical friction from a synthetic sanitary pad. If our skin has the biological capacity to sound such a massive alarm in response to everyday synthetic materials and chemical surfactants, what does that tell us about the hidden, everyday products we blindly trust against our body's most sensitive barriers?
That is a very profound question.
Are we constantly prioritizing commercial convenience over our own biological design? And what else might our bodies be trying to tell us if we just stop to listen to the friction?
It is a fundamental question that challenges how we interact with all the modern materials surrounding us.
It really is. Thank you for joining us on this deep dive into the source material today. We hope this exploration gave you the clarity and the biological roadmap you need to make the best choices for your own health. Until next time.